All right, so let's talk about PPE in the COVID era. How has COVID changed how we protect ourselves? One of the first things that we're going to change to how we do things is going back to that dangers, right? The D in DRSABCD. We're not going to approach too close. We'll maybe come 2 meters away and ask ourselves, what are the dangers to me, the patient, bystanders? What is the community risk right now? Are there outbreaks? Is it a time of lockdown? And even questions of what are the risks to my family? Some of the stuff you can think about ahead of time and say, are these the responsibilities I want to take up? I'm fine with it and I'm willing to get right in there. But that risk assessment will be different and individualized with every patient, every lifeguard, every time. So you see something happen. We're going to stop with the D in dangers and just think, is this a good time to get PPE on? And in this case, we're going to use our gloves, which hopefully you'll have with you on your fin belt. There's a little pocket in back, and you should have a face mask, a pocket mask for CPR, and a pair of gloves in there. So we've got gloves on. We want to protect our eyes and our face. So we're going to put on a face mask, and the question often comes up, how do you use these things? Well, which side do I wear? Is it up or is it down? So a couple of things. One side is woven. The other has a little bit of a water-resistant coating to it. It goes around your ears, obviously. And the neat thing is there's a wire band that goes across the nose bridge to get rid of some of the dead space. So you can pinch that down across your nasal bridge from side to side, and it should make a good seal. All right? You don't want to wear it down below your nose. You don't want it to be half on, half off. You want good coverage like you have there. And we've got eye protection. One of the other things that we're telling people now is as you're doing your doctor's ABCD, as you get to that checking the breathing step, we used to feel for breaths on our cheek as we're looking down the chest. So it's look, listen, and feel for breathing. We've modified that now. We don't want to be in that moist breath zone. We want some separation. You can still feel, if you need to, for respirations on the chest or abdomen. You're still looking for, in this case, abdominal rise and some chest expansion. So you can still do those things. And that's how you're going to assess ventilation in sort of a COVID era. To the extent that you're able to, create some separation from the patient. So you're done with your assessment and your intervention. If you don't need to be right there, stay away, give some room. Can we be doing this resuscitation outside? It's vastly preferable to have open air ventilation for anything we do with a patient than to bring them into a first aid room, a clubhouse, an enclosed space, and have the same stale air circulating around. Traditionally, we rush them into the first aid room. If we don't need to, we can do more of our assessments outdoors, and that'll obviously be safer for us. So we're going to talk about doffing or removing our PPE now. One thing you want to be aware of is that you are now contaminated, right? So resist that temptation to touch yourself, right? Very, very common. You put the hands on your hips or just down, or you touch articles. You're going to treat yourself as contaminated, so the hands kind of stay out. And you're not going to want to contaminate other things. So you're going to go straight to a rubbish bin. So you can remove your gloves. And those just get dropped in a rubbish without a lot of extra handling. They get peeled off and just dropped in. The glasses can come off and they're going to get disinfected with a spray disinfectant, so they would go in a little bin. And then here you just don't want to touch the blue. You want to get it away from your face and just drop it. Don't handle it extra. It's done. Okay? And then you're going to hand hygiene. After every step of this, it's going to be disinfect the hands with alcohol, sanitizer,